Well, today on the show, we're at Singing River Medical Park in their radiology unit, and we're talking to Tayonka. How are you?
Fine.
Thanks for being on the show with us.
Yes, sir.
Tell us why you're here.
Well, I was just diagnosed with breast cancer. I came in to see Dr. Polchek, and he was the radiologist at the time who went over my mammogram, and he referred me to Dr. Bailey for surgery.
Okay, and so here real soon you're going to have a double mastectomy.
Yes.
Okay, now you said they only found it one side, but you chose to go ahead and do lateral mastectomy.
I did. I chose to do the lateral mastectomy because Dr. Bailey referred me to genetic testing, and I just made my decision off the genetic testing results. Now,
they have a new system here that they use. It's called 3D, and we're going to talk to Dr. Palchow about that in just a little bit. But was it an easy, it's never an easy experience to go through, but did you find that the system that they had here made it better?
Absolutely. Whenever I did the mammogram, they were able to do the mammogram here that day, give me the results that day. Dr. Polchek sit down and actually call Dr. Bailey for me to make the appointment. So everything worked out very smoothly and easy.
Okay, well, great. Well, we're going to wish you all the best. I know you'll do fine. Anyway, we're going to talk to Dr. Palchow right now, find out more about the new 3D system they have here at the Imaging Center. Dr. Palchow is the radiologist here. How are you, sir?
I'm fine.
Tell me first a little bit of background about yourself.
Well, I've been here at Pascagoula with Singing River Hospital and System for about 23 years now.
Wow.
And I've had an interest in mammography since I was a resident, and I've kind of taken it to be my area of interest.
Expertise.
Yeah, yeah.
Now, mammographies have come a long way. Over, years ago when they first started doing these or whatever, and they had the machine, and a number of times you hear, sorry ladies, I know you complained about going in and getting your boobs smashed down in that machine, having to do that once a year, especially when you get up to a certain age, or if they do have some chain, or I can't think of the word of it, that runs in the family.
Yes, yes, a family history, a strong family history, or a genetic predisposition to cancer, yeah. Well, mammography has evolved. It used to be, going back many, many years ago, it used to be Xerox paper, and a Xerox process where they would actually get a picture, and it's evolved to film screen, which became obsolete really a few years ago, and it went to digital mammography. Well, the next step is this new 3D tomosynthesis, which we have here, and we've had these in about a month, and we're getting geared up on using them and up to speed with them, but it's turning out to be really a wonderful thing. It's much more sensitive for detecting small and difficult to see cancers, particularly in women who have dense breasts or heterogeneously dense breasts. It helps all women, but it's a particular benefit in those particular patients because those cancers can be very hard to see. They're hidden by normal breast tissue, and you have to actually literally peel away the area so you can get a better look. And this new equipment and technology offers that opportunity, and we're very grateful for it.
Okay, how about this one? Women with implants.
It's improvement for women with implants because with this equipment we can actually see through the implant.
Really?
Yes. That was a problem with implants because you could never ever see all of the breast tissue in women who had implants. Even if you did all the positioning and there were still areas that were hidden and were just not well evaluated. And of course, that could be where something bad was hiding, and we didn't like that. But this new equipment actually allows us to see through implants, and it's a boon to be able to help
catch things at an earlier stage.
That's the whole goal, is to catch things at an earlier stage. If we can catch them at an earlier stage, then treatment can start earlier before bad things like metastasis or the tumor gets to an advanced stage occurs. If we can find it earlier, we feel like that is a good thing because we can start treatment earlier.
I know, talking to Tayonka just a few moments ago, they're finding it at a relatively early stage and be able to do something about it before it got bad.
Right. Well, you don't want to find it late.
Right.
Well, once the clock starts running, that time you can't get back, and you want to start fighting these problems as early as you can. And this helps us find those small cancers, especially early.
Wonderful. Doctor, thank you so much. We're going to talk to a couple of your technicians, if you don't mind, and find out exactly how she has a name, how she works. Now, Olivia is the chief mammographer here at the Pascagoula location, and Tina is the chief mammographer at the Ocean Springs location. Both locations have the Pristina machine. Tina, tell us about this now, and exactly how this all works.
Okay, so this is our new 3D mammogram machine. So people always ask me, well, what is 3D? So I like to tell them, well, it looks and feels the same as the regular 2D mammogram. However, this machine has better technology. So what it does, it allows the radiologist to look through the dense breast tissues in 1 millimeter slices. So that allows for us to be able to detect cancers at their earliest stage whenever it's like the most treatable stage. So we are very excited about that, to be able to provide this service for the ladies here on the coast.
That's awesome. Can you give us a little demonstration how it works?
Absolutely. Okay, and this is how she works. Okay.
That's it?
That's it. As you can see, it did the 25-degree arc. It took 9 pictures, less than 10 seconds. So it started from the bottom.
How much time did the 2D used to take?
It's a little bit longer than the 2D, but the great thing is the patient doesn't have to hold their breath anymore. With 2D, we would always make the patient hold their breath. So with the 3D, because it is tomosynthesis, we do not have to have the patient hold their breath. So that's a little bit better.
That is amazing. That is amazing. Brand new technology. I mean, that is the coolest thing. And of course, if someone in the area or whatever, whether they're anywhere in Jackson County that want to use the services, what they need to do is, of course, if you're not sure, go to your primary physician and just basically, I guess, get a referral.
Yes, you would just see your primary care physician, and then you would have the doctor would, give you an order the same as the 2D. You don't have to do anything different or anything special. And you just call in, either let them know that you want to do 3D, or we also pre-screen our patients as well to make sure they're getting the services that they need whenever they come to see us.
Thank you so much.
Thank you.
Tina, Olivia, again, if you need the help, give them a call.